Hello, I'm Dr. Mark Dailey. As many of you know by now, I am a doctor of chiropractic that specializes in chronic conditions. I graduated from Life College of Chiropractic. I studied and graduated from Functional Medicine University. I have advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and natural thyroid treatment. Building on our last video, remember we said that the gastrointestinal system is like a second brain. We explored the connection between your brain and your gut. We saw that they actually originate from the same tissues and that they have much in common. It's said that 60 to 80% of the immune system is contained within the gut, and that your gut, if your gut were spread out, the surface area would be just about as large as a football field. Now, I mentioned earlier that I really don't want to bore you with all the details of gut function, but at the same time, I want you to understand how amazing your gastrointestinal system is and how it relates to good health, and equally as important, how it relates to chronic disease. Ultimately, I want you to understand the intensity of gut function, what its job is, and what happens when it breaks down. I'll also give you an overview of what causes the gut to break down, then outline a program that's meant to restore proper gut function. Now, gastrointestinal dysfunctions are probably the most overlooked and mismanaged disorders in the healthcare industry today. Traditional healthcare providers are seriously lacking in their ability to diagnose and identify functional gastrointestinal patterns. They are simply not trained to provide adequate lifestyle and dietary support, and they have trouble linking the web-like patterns of these systemic disorders associated with gastrointestinal tract dysfunction. A good example of this is a recent survey from the American Gastroenterological Association. It stated that symptoms of gastrointestinal tract dysfunction existed with no structural, pathological, radiological, or laboratory findings, and this comprised 41% of their membership practices. No doubt that these are patients that are told their gastrointestinal symptoms are normal and, of course, suffer from chronic health dysfunction. The identification and treatment of gastrointestinal disorders is certainly doomed to fail if treatment involves traditional drugs like anti-inflammatories or antacids or enteric nervous system inhibiting agents. These approaches definitely do not address the underlying cause or triggers for these dysfunctions. Instead, the drugs are trying to give immediate and temporary relief to cover symptoms. Now, it is absolutely crazy for patients to take an anti-inflammatory for chronic inflammatory bowel conditions without looking for the trigger. In other words, why are they inflamed in the first place? See, the main problem with allopathic approach, or the modern medical approach to gastrointestinal dysfunction, is that it's based on the emphasis of suppressing symptoms versus really improving gastrointestinal function by removing the trigger, which is the cause. This approach only leads to chronic dependence on medications that actually prevent the gastrointestinal tract from optimal health. Now, let's cover some basics. The digestive system is a portal for food nutrients to get into the circulatory system, which relay it to each of the body's billion cells, or billions of cells. Before this can happen, food must be reduced to very simple molecules by a combination of mechanical and chemical degradation. The resulting molecules are the building blocks of life. We're talking about sugars, amino acids, and fatty acids. This complex process is digestion. Therefore, the gastrointestinal system has to take the food from your plate and break it down into such small molecules that it can make its way through the gut lining into the bloodstream. Now, that may sound simple, may sound fairly easy. However, it also has to protect you from things that have no business being in your blood. So, not only does it have to break down, digest, and assimilate your food, it has to protect you from that which would be harmful if it made its way into your blood and ultimately into your cells. There are three main barriers in the body: the brain barrier, the lung barrier, and the gut barrier. When these barriers are compromised, disease is without question the result. Now, one of the main jobs of your gut is to keep its barriers from compromise. And compromise of this barrier is one of our main concerns for good health. See, the GI tract is connected to every major system in the human body. Over 60% of the human immune system is located in the gastrointestinal tract. The GI tract communicates with every major receptor using its own intercellular mediaries. It's responsible for the production of 99% of the body's neurotransmitters. In addition, the GI tract has very high metabolic function, impacting nutrient absorption, elimination of toxins, hormone metabolism, energy production, and much, much more. We're going to talk about the GI tract as it relates to pain, inflammation, functional hypothyroidism, autoimmune disorders, adrenal stress syndrome, anemia, mood, inability to lose weight, food allergies, cardiovascular risk, neurodegenerative disorders, and chronic fatigue. Now, if you want to take advantage of our offer for a free consultation, remember I mentioned the retail price is $275. I am offering that to you if you would like to take advantage right now. We want to be sure to meet the needs of all of our patients, so we only accept 10 new patients each month. So if you're interested, call right away. The number's on the screen. Otherwise, thank you for your time and attention, and look forward to the next video here in a day. Thanks so much. God bless, and I wish you the very best of health.